with,
Was it the trials?
Do you see a distinction between a right to health care and a right to treatment? Back in the late 50s, they had the Health Burden Act, which was there for people who could not afford to be treated medically, and because we're a sophisticated society, everyone should be treated to the best of a hospital's ability to treat them. And anyone who couldn't pay for that treatment, their bills were covered by the Health Burden Act. Now, I'm a proponent of covering someone's treatment, but not covering their health care, because when you have people between the ages of 18 and 33, the likelihood that they're going to get a catastrophic illness the probability is quite low. So why pay $12,000 to $24,000 to cover them, to insure them during those years, when we can create a fund that will cover them in the event that they get a catastrophic illness? So to use that as an alternative to health care and just grant them the right to treatment.
Yeah, I think I understand where you're going with that, and I think I agree with the right to treatment more than the right to health care. There are some obvious difficulties with just covering treatment because it's expensive. So if you had, there's minute clinics and CVS's, if they could perform a broader range of services at a low dollar cost, that's helpful. You have to figure out where you're going to draw the line with treatment that should be covered automatically and shouldn't. Somebody had an interesting idea, which was to bill everybody, essentially, who came in for treatment in an emergency situation. Some people, for various reasons, aren't going to have the means to do that. For the others, you essentially bill them, and if you don't get it, you get a lien. And over time, you get the money back. And the threat of actually having to pay for things is going to push some people into the system. So I think that there's some good market-based solutions. I think if you have interstate competition for health or for insurance providers, I think you're more likely to have niche providers who will be, looking for people of this characteristic or that characteristic, just like you have who can't get auto insurance. Right. Same sort of thing. All sorts of different, there are some exceptions to that, but all sorts of different plans for all sorts of different people. And I think that the more you reduce the constraints for insurers, the more you're going to get solutions that cover a broader swath of the population.
Free market.
Bingo.